We're joined by Suzanne Spernal, who is Vice President of Women's Services, RWJBarnabas Health. Good to see you.
Thank you for having me.
Clinical background, APN, and advanced practice nurse.
Yes.
We have you on to talk about a whole range of issues having to do with maternal health. I want to get on this right away. As we were researching this program, there's something that struck me. 44 states deliver better maternal health outcomes than New Jersey. What? Why?
So that's a good question, and the answer is a little complicated. So let's take a step back and talk about what a maternal death is, what maternal mortality is, and then maybe the why will make a little bit more sense. So a maternal death is a death that occurs anytime during pregnancy, the day of delivery, and up to a year after the pregnancy is completed. And I think that a lot of people, when they hear the term maternal mortality or maternal death, they envision something, a catastrophic event that happens while a woman's delivering.
In childbirth.
Exactly. But we know that the majority of maternal deaths are occurring after mom gives birth and is back out in our communities.
What is that, excuse me for interrupting, is that the 42 days after?
Yes.
What's going on then?
So it's a multitude of things, but the most common causes of maternal mortality in that time frame are cardiac complications, hypertensive disorders of pregnancy, women having blood clots, women having a stroke. And I think part of the problem is that there's a lack of awareness.
Of what? Okay, so women out there right now, men and or women, but men concerned about the women in their lives.
Thank you for saying that.
What should they be looking for?
So I think that women and their families and even their providers tend to minimize complaints that for you or I, if we were to say it, would be probably benign. And I'll give you a good example, a headache. So
within the 42-day period after birth?
Yes.
I get headaches.
Right. I get headaches also.
But what happens to a woman who's just given childbirth 21 days after? Go ahead.
So let's make it even closer. Let's close that window a little bit. Let's say 7 days after, mom's sleep deprived, maybe she hasn't been drinking enough water, maybe she hasn't been eating well, and she's got this headache. And she's taken some pain relievers, and that headache's just not getting better. So her family, her support people may say, you're just tired, you had a baby, this is normal, you'll be fine. But it's a cardinal symptom of something called preeclampsia. Preeclampsia. So that is when a woman's blood pressure is elevated, and sometimes it's elevated to a level that's quite concerning and can cause a woman to have a stroke. And so what we want women to know is, and their families, is not to minimize these symptoms. And we want ED providers because that's probably the first touch point,
Emergency department?
Yes.
Go ahead.
So a woman presents to the emergency department and she says, I have a headache. So if I go to the emergency department and I say, I have a headache, they're going to say, okay, have a seat in the waiting room, because it's probably not a big deal. But if a woman that's just had a baby says, I have a headache, that's a really big deal. And she needs
potential stroke, because time is brain.
Yes, time is of the essence. And one of the things that we've taught the emergency department providers at RWJBarnabas Health.
By the way, to make it clear, RWJBarnabas Health is a big supporter, significant supporter of public broadcasting on many levels. Go ahead. Okay.
Is that these women need to be expedited into care. And we've taught them that...
They can't be treated like everyone else. Excuse me, I'm sorry for jumping in, Suzanne.
No, that's great. No, they can't be treated like everybody else. And the thresholds and the treatment algorithms are different than a woman in the general population. So what we've done to heighten that awareness in our system is we have put a trigger and alert system in our emergency department.
Trigger and alert.
Yes. So what that is if a patient has had a baby in our healthcare system and presents to the emergency department in that 42-day window, when she is registered, an alert fires, and it says, this patient's had a baby in the past 42 days. Because we know that sometimes when a mom is not feeling well, she may not self-identify. And we know that sometimes with all of the competing priorities in the emergency department, an ED provider may not think to ask that question. And we know that those symptoms could be an indication of something very, very serious and life-threatening going on. We also have built in a second mechanism, because what we know is sometimes, even though a woman chooses one hospital to have her baby, she may go to an emergency department that's closer to her home.
Why is that relevant?
It's really relevant because of that 42-day window. So
Hold on one second. What is really going on with most women's bodies, including the brain function, and that 42-day window that some of us lay people don't understand?
It's through the whole pregnancy. Your body goes through a lot of changes to accommodate the hormones and the increased blood flow when a woman gets pregnant. And what happens is, with these changes, there are some blood vessels in the brain that become more vulnerable to women having a stroke. So what may be a acceptable blood pressure for me, for a woman that's pregnant or has recently had a baby, can cause her to have a stroke. And those thresholds are much different.
Do this, Suzanne Spernal, who is talking to us about a whole range of issues having to do with maternal health. Give some advice to friends, family, those who are closest to those who are either having a child, who are in that period after having a child, who care deeply about wanting to be helpful. They're listening and watching right now. Go ahead.
No one knows your body better than you. And if you're not feeling right, then ask questions. And if you're not satisfied with those answers, keep asking the questions till you get an answer that makes you comfortable. If you are a family member or a support person for someone that's pregnant or just had a baby, be their advocate if they can't advocate for themselves. Know that there's no symptom that should be minimized, and that we need to...
Don't blow it off.
Don't blow it off.
No big deal.
Yeah, no. We should never be saying those words to women.
Suzanne, I want to thank you so much. You've provided a very important public service. Well done.
Thank you.
Okay. This is Think Tank. I'm Steve Adubato, and we'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berry Foundation, PSC&G, ADP, the New Jersey Education Association, NJIT, Horizon Blue Cross Blue Shield of New Jersey, and by Adler Aphasia Center. Promotional support provided by NJ.com and by New Jersey Family Magazine and NJFamily.com. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.